Cannabinoid hyperemesis syndrome. Cannabinoid hyperemesis syndrome is a functional disorder of the gut-brain axis linked to continuous and long-term cannabis use. It is characterized by episodes of nausea, vomiting, and abdominal pain. It was first described in 2004, and since then, a significant number of cases have been identified. It usually occurs in two stages. The first is the prodromal phase, characterized by anxiety, severe nausea, sweating, and increased thirst, with the most severe symptoms occurring in the morning. This stage can last for months. This is followed by a hyperemetic phase, with debilitating abdominal pain, nausea, and vomiting. These symptoms make it difficult for the patient to eat, which can lead to significant weight loss if sustained over time. It can also cause severe dehydration. At this stage, patients often develop compulsive behaviors, such as bathing or showering with hot water, as these activities are soothing. However, the soothing effect does not last long. Capsaicin ointments have also been shown to be helpful in mitigating symptoms. Another feature of this syndrome is that nausea does not respond to the usual antiemetics. Recovery requires a period of abstinence in order for the symptoms to disappear. These cease within a few days of stopping cannabis use and disappear completely within a few weeks. They are very likely to reappear if consumption is resumed. Preclinical studies and data are limited, but they seem to suggest that high and prolonged doses of THC lead to changes in the endocannabinoid system. By acting on the cannabinoid CB1 receptor, these changes may disturb mechanisms for stress and anxiety response, as well as thermoregulation and the vomiting reflex. The number of people affected by this syndrome and, in general, epidemiological data remain largely unknown. A study in the state of Colorado found that hospital visits due to vomiting in cannabis users increased by 30% since legalization. Another survey found that in patients attending a New York hospital who use cannabis for at least 20 days a month, more than 30% had shown symptoms consistent with cannabinoid hyperemesis syndrome in the past 6 months. Although it is associated with prolonged and continuous use of THC, some cases have also been reported in patients using CBD. Some studies suggest that the syndrome could be linked to a genetically determined sensitivity of the cannabinoid receptors, as not all those who use cannabinoids continuously and for long periods of time develop it. Understanding the physiopathology of the endocannabinoid system is essential to explain the clinical characteristics and possible pharmacological targets for the treatment of hyperemesis syndrome. If you are a cannabis user and have any of these symptoms, stop using cannabis immediately. Consult your doctor and inform them that you are a consumer and that you might be suffering from this syndrome. In any case, always avoid continuous and prolonged use. For more information, please visit our website and check out our articles.